Hello, I'm Dan Mustard, the Executive Director of Milray Center in Columbus, Indiana. We are a community center for active adults age 50 and over, and today I'm joined by U.S. Senator Mike Braun. Mr. Braun is currently serving his first term in the U.S. Senate, having previously served in the Indiana legislature. Mr. Braun came from the private sector as the owner of a large auto parts and accessories distribution company that's based in Jasper, Indiana. Among his committee assignments in Congress, Senator Braun currently serves on the Senate Committee on Aging. Welcome, Senator Braun.
Good to be on.
Thank you. In the interest of time, we're going to just jump into some questions. First, we'll talk just in general about some issues that are of interest to seniors, and then we'll move into some specific questions from some of our members. And the first, because it's very topical, it's something on the minds of everybody, and that is COVID-19, which is especially, I think, having an impact on seniors. Are you, sir, comfortable with the measures that have been taken at the federal level to address the current COVID-19 situation, especially for older adults?
You know, when it comes to what we do there to especially direct the healthcare component of it, I think that I've been okay with it, but I think it's very clear that elderly with comorbidities, are the most vulnerable group. And when you look at, in some states, the fatalities are over 50% individuals, living in nursing homes. That to me is not doing a very good job. I think we really have got to pay attention to best practices in terms of those places that have been able to keep the percentages much lower. I think it also, had we done a better job there, we don't have the dual challenges now of getting better at that kind of later in the game, and also having to struggle with the economic issues that Main Street especially is going to have to contend with. So I know we'll get the information in terms of what has worked. I think the laboratory of 50 states will probably gain us that, but it's a peculiar disease. It's got a lot of different facets to it, where we looked like it was going to completely pass over the very young, and now you have the pediatric inflammatory syndrome. So we got to be careful with it. It's different from what we've seen before. Disappointed, though, that we have not built more of an iron dome around those most vulnerable, and then secondarily, the practitioners, the caregivers that are in the trenches fighting it. So I think that's hopefully what we'll get better at, learn when it resurfaces. Hopefully it doesn't, but it probably will. And I think we'll learn a lot from other countries as well.
Mm-hmm. Well, to follow up with that, when it comes to reopening the country, and at times it seems that President Trump might be at odds or in disagreement with Dr. Fauci and the task force. How do you as a leader balance the health and wellness of the public with the economic impact of stay-at-home orders?
So I think that is where we'll have to, when it gets into the rearview mirror, and hopefully even before that, looking at Japan, who's got a profile of being very old in terms of their average age of population, have done a good job. And I read just a little bit ago, how did they do it? Well, they said everybody did pay attention to the rules. They kept the 6 feet of distance, just did things without breaking them. And when you reopen, you better be paying attention to that stuff and not act like it's going to be returning to the way it was 3 months ago. I think some places had the discipline to do it, recognized it, got their citizens to kind of do it individually as well as collectively, and you get good results. So we're a country that's built on mobility, a lot of individualism, a lot of things that make us great, maybe not so good in terms of how you wrestle with COVID-19. So long and short of it is, if we want this to be successful in terms of reopening, and we need to, because we didn't need to shut down as much as the economy as we did, My wife's store is downtown Jasper. Every business was shut down. Most of them had low traffic volumes, could have paid attention to those rules and not, waited 2 months to do it. But I'm more about what we do going forward to get it right. But clearly, pay attention to the rules if you don't want to relapse. And I do believe we can do both at once. Japan kind of proved that, and I think other countries have as well. And some states, Florida has done amazingly well, probably the profile that would have the high, a lot of vulnerable people. They took that part seriously, protecting the most vulnerable, and yet opened up their economy in general very broadly. So maybe we'll learn something from them and a few others that kind of did two things at once successfully.
Very good. Well, let's shift gears a little bit away from COVID. And in some ways it might be related, because I think a lot of people are spending even more time on social media now, which is not always the most accurate source of information. And I have noticed that there has been some postings regarding Social Security, Medicare, Medicaid, those types of things. And quite often there will be rumors about cuts or that the funding will run out. This is an important topic for seniors. Can you please talk a little bit about the stability of this funding moving forward and the sustainability of it?
So you didn't mention I'm on the budget committee, as well as health, education, labor, and pension. And when it comes to the budget committee, that's probably the most important committee we have that actually doesn't do anything anymore. We haven't done a budget that we've appropriated to in nearly 20 years. But most of the structural deficits we've got are clearly due to Medicare, Social Security, and then less importantly, Medicaid. But now the Medicare Trust Fund, due to the fact that healthcare costs, and that's been the other passion of mine, in addition to having the political will maybe to do a budget, is to reform a broken healthcare system that costs twice as much as most other developed countries, and our results aren't any better. There's no competition, there's no transparency. The healthcare industry, is really not given us an effective and an efficient system. That's driven Medicare as the main driver that has these structural deficits. Social Security, we're living longer. The retirement age has not really been adjusted much. And all of this, clearly, you got to have political will to fix it. Medicare, we can really do two things at once. We can reform the healthcare industry and get it out of the danger zone. It is due to be depleted with automatic 18% cuts in about 6 years. That is almost insane to think that we wouldn't be doing something. That's right around the corner. Social Security, that doesn't happen until like 2034 or 35. But we need to get at it, and it's on Medicare. Let's look at that. If you cut costs by just 5 or 10%, don't need to maybe reduce it by 30 to 40% to bring it in line with other countries, that'll extend the time that the trust fund will be intact. On Social Security, it's a little simpler. You'll have to look at 3 or 4 variables: raising the retirement age, maybe taking some of the extraneous benefits we put into it and keep it focused on retirement. You can raise payroll taxes. Those are at a fairly high level to begin with. I think 15.3% employer and employee for Medicare and Social Security. Political will. We can do it and get it out of the danger zone so it's there for future generations. But some tough decisions have to be made.
Okay. Well, thank you for that. One other topic that is currently a pretty big discussion point in Indiana, especially among senior leaders, is that Indiana ranks 51st in the nation among states and Washington, D.C. for long-term health care for seniors, including caregiver supports. Do you think this is a federal funding issue, a state funding issue, a combination, or is it neither one? And what can we do as Hoosiers to address this situation?
There's another bad statistic, is that we're one of the most unhealthy states as well. And that's why I think it was even more. We were more vulnerable as a state due to that predisposition and dealing with COVID-19. But I think it's probably more of a state responsibility. So many people come to the federal government, and you got to remember, at least our state has a balanced budget and a rainy day fund. And that is far better than the federal government, which has neither. And at some point, whether you deplete the Medicare Trust Fund, whether we are no longer the only reserve currency that makes our interest rates so low that enables us to borrow money so cheaply, I'd feel more comfortable if the state actually, first of all, I don't think there's any reason the federal government has impacted Indiana to have that poor ranking. It's probably something where we've not put enough emphasis on it. And for people that are really interested in improving that, I think you'd have a better business partner with somebody that balances their budget and has a rainy day fund, as opposed to somebody that borrows every penny, to finance these deficits, which now constitute about 25% of our entire budget. So I think our state is where I have the most confidence. Legislators need to find out why, come up with some good legislation and programs. Don't look to the feds to do it.
Mm-hmm. Very good. I know that's something that a lot of people discuss here, and quite often it seems to be the kind of the knee-jerk reaction is we need to go for federal dollars, but at the same time, it's a difficult conversation to have at the state level, and so I think it's encouraging to know that perhaps we can have that conversation with folks at the state level, as well as lending a hand at the local level and seeing what we can do to hopefully address that situation. There are some questions that I have that were submitted by our members. One of those is from Deborah, and she said that many seniors like to take advantage of early voting, especially by mail. What can we expect from Congress in terms of support for the Postal Service, at least through the end of 2020?
I get that question asked a lot because that's another example of something most people think is essential to some extent. And even though they still are doing things that aren't probably keeping up with technology and the fact that the need for that service, it's not analogous to the Pony Express, but it's got something that needs to change because it's not sustainable. I think it's going to stay around. Last time I was asked that was about a week before we had the hiatus due to, not being in DC. And I said, I want to try to fix it structurally rather than putting a Band-Aid approach. And that's borrowing the money from the general fund that, again, doesn't pay for itself, goes to the borrowing market for 25% of what it spends, and get it to where maybe mail doesn't have to be delivered every day. Maybe they put more emphasis on parcels, which seem to be really up and coming and a big demand for it, but do something to where it operates in the black based upon changing its cost structure so that it can live sustainably into the future. So I don't think there are any of us there that are looking at shutting down the Postal Service. It's just that how often have we been hearing that they need to either dramatically raise the price of a stamp or need a bailout from the general fund. And I think this is high time that we make sure that whatever we do, it's on a trajectory to where it's going to operate sustainably.
Okay. Very good. So Ross asks, what measures are you promoting to meet the physical, mental, emotional, and healthcare needs of the older population? Do you think this is a national priority or should it be a local priority?
Well, the federal government, and so many people look there simply because it's the highest authority. I'm trying to think what they've knocked it out of the park on over the last several decades. We get more cases started involved with the VA, the Veterans Administration. And you'd think with all the reforms that have been made and for the purpose that it's there for, that it'd be a smooth running machine. No, it's the exact opposite. Once you get in there for healthcare, that's not too bad. But I have people that can't get through, that try to follow up on a simple issue, and you got to get a senator's office involved. And then, yes, you'll get some action, but it tells me it's not working. So when it comes to anything else that you're wanting the federal government to do, I think it's, like I tell most people that come in, find a new business partner, look to your local and state governments, or to how you do it maybe outside the framework of government, because you've got transparency, you've got accountability, the closer you get to the trenches of where things get done. And that might be try to do it through the private sector. Ideally, next step would be local governments, and then states. The federal government ought to be the last resort because they've not proven to do things effectively and efficiently.
Well, in a perfect world, what would you say then would be the role of the federal government if they had a better track record, perhaps, of doing that, especially when it comes to seniors? What should be the role of the federal government then in the health and welfare of seniors?
Well, maybe to get Medicare and Social Security on a solid footing.
Mm-hmm.
And again, we'll get right up to the precipice and probably solve that by a crisis. I mean, maybe a general framework. The feds do, like the National Institute of Health, CDC. CDC fumbled the whole testing thing for 40 days when they wanted to do it. And CDC never makes a test. They can have control. It's just like highways are built through the regulations of the federal government. Generally ends up costing 15 to 25% more. But I think once you got to where you were doing your major responsibilities well, then maybe put a framework out there and do what I always liked about the federal government, make sure there's equal opportunity and that there's not some travesty out there being allowed by states to where you set general guidelines. But I think the more you look to the feds to actually get into the weeds or do things, expect more of the same. And that is that it just does not do a very good job at it.
Okay. Howard posted this question. He said that research indicates that socialization is the most important factor in longevity. Since many seniors will not be able to access community services, would you support additional funding for more home-based services that help to address social isolation? And again, this probably goes back to, in some ways, Medicare and Medicaid funding. But what would you say?
Yes, and for as much as we spend on that, I think it's definitely, we ought to find out what is better. I know some of the more effective results are being realized where it's home-based care. And some states have gone very aggressively to that, away from nursing homes. I don't know that there ever would be one system that's perfect. There ought to be enough ability for those two to compete in a way that whoever ends up using it has a good option either way. And it could be that home-based care, for all of the reasons that seem to make sense, to where you can stay in a place that you feel comfortable, to where you can get that care in a way that in many cases it can be less expensive. And I think just like in markets, generally the best provider at the lowest cost and it's most effective ends up gaining market share. And I think in this case, there's probably a real case to be made that that is happening right in front of us as we go through not only this crisis here, because it really brings it into focus, but in general.
One of the questions that we have had, a couple of different people ask this, and it involves funding to senior centers specifically, and this goes back again to social isolation, because a lot of folks depend on local senior centers for their socialization. And at the same time, it's very interesting to me because I came from the disability services field originally. And there are much more funding streams that are available for that area, not so much for senior centers. And so I guess one of the questions is, what kind of guidance could be provided at the federal level? Again, less hands-on, but guidance in terms of funding for senior centers and community-based services for seniors that currently doesn't exist. Is that within the purview of something that the federal government could do in terms of guidelines?
I mean, guidelines to me are always going to be something that you should probably try to improve and finesse. And I don't think there's anything wrong with a federal framework, just like the president set out a framework for reopening the economy in 3 stages. As long as you met certain criteria, you could then feel safe to reopen. Some states obviously jumped the gun. And that's probably because they had a better feel for what was going to work in their own state. Florida, I think Texas would have been the 2 most notable. Georgia, I think, was actually first. And they all seem to be doing pretty well. So again, the feds, when it comes to guidelines, especially if they're in on part of the funding, I think you're going to have to put up with that. Sometimes there are unfunded mandates that come with it. And then you better hope those guidelines are good, or that you got flexibility to moderate them, when you're not getting any money to help pay for it. So I think that so much of federal guidelines and what the federal government does is going to have to maybe be justified and called for after they do fewer things better. And in the meantime, my advice to anybody looking to the federal government, now that I've got an upfront and close look at it, and I bring you back to all the cases we have on the VA, is I think that is wishful thinking, in the sense that they got to really improve their track record before I would be wanting guidelines from them, especially if it comes with an unfunded mandate.
Very good. Well, sir, I really appreciate the time that you've taken to be with us today, and I would like to give you an opportunity to have the last word. This is a chance to reach out to the constituents, and especially the older folks here in South Central Indiana. The floor is yours.
Thank you. So, all of us want to get to the point where when you get into that last quarter of life, that you're feeling good, you've got the care you need, you've got the time finally to enjoy it, enjoy your kids and grandkids. And I think when you look at the statistics, we've got a lot of room to improve there. And some of it will have to come from our own kind of discipline and ability to find out how we make lifestyle changes. I pay real attention to that. I think that's so important, because there's no substitute for your own well-being than you to make sure that you take care of yourself when you get to retirement age, that you can enjoy it. When it comes to remediation, I think that's where we got to find, maybe some different ideas and ways of doing things. And I think I've made it clear that that's probably not looking to the federal government at this point. I think there are a lot of other ways to do it. But in the time I'm there representing Hoosiers on great committees, health, education, labor and pension, and aging, and the budget committee, I think that I'll be finding ways to make the federal government do a better job. And then I just advise everyone, look to yourselves and maybe your state and local governments, because I think you'll be less disappointed in the outcomes.
Well, thank you so much, sir. I appreciate the time and the information that you've given us. I know you have a tight schedule, so with that, we will say thank you, and God bless you.
It was enjoyable sharing the time with you.
Thank you.